Well, joining us now is the chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. He joins us now from Durban. Thank you so much indeed for joining us. A rise in the number of bogus doctors. How can that be?
Hi, Peter. Thank you so much, and good evening to your viewers as well. This is a common occurrence in this country, Peter. It's been a long practice where you find that, in the most remote parts of the country, there are fake doctors, who are there to make money. They are not registered with the HPCSA, and they not only in the private sector. Sometimes you do get them in the public sector, where they actually get employed, without these documentations. So it is quite important that, in fact, this is an indictment to the HPCSA. The HPCSA is supposed or ought to protect the public, and guide the professions. But it seems like work has not been done in this case, because they're supposed to be going out in the communities, educate communities on how to identify these doctors and how to report them. They need to know. People need to know out there that there's a regulatory body called HPCSA. It's not known. That is why people don't know what to do when there's a bogus doctor in their community.
All right, so there's another layer to this that's concerning me, because in that package that we just played now, it seems as if one of these doctors was able to write out prescriptions that people could go and fill. Don't the pharmacies check the scripts and who's prescribing them to see if this is coming from a genuine doctor? Otherwise, people just come with pieces of paper.
Yeah, correct there, Peter. The pharmacists are supposed to verify, the prescription, whether, the prescriber is really authorized to prescribe, and obviously they will have to access, the HPCSA website, have a look at the register there and see if the doctor is really actually a real doctor. But what I thought the HPCSA would have done, I would have expected them to have, have a strategy, a multi-pronged strategy with multi-stakeholders, on how to, obviously curb this occurrence. But I don't hear them when they talk about this thing. Even when we engage with them, I don't hear them having a strategy, to empower communities, including other healthcare workers, to make sure that they identify these bogus doctors or practitioners and actually report them, so that we protect communities from this unfortunate occurrence.
These doctors are practicing in plain sight. It's not as if they're trying to hide their practices. They're in full view. People can walk past. Police drive by all the time. Where is the disconnect? As a civilian, I guess I might not know. But surely authorities like police who are driving past these places should be keeping an eye on these kinds of things.
Well, what happens there, Peter, is that at times you find a fake doctor being employed by an actually registered doctor, running a practice of a registered doctor. What sometimes happens is that some of our colleagues who are employing locum doctors to run their practices don't actually verify them with HPCSA, whether these are registered, qualified doctors who are registered in the country. And you find that, for some reason, a doctor is not available to run his or her practice, and they, hire a locum, only to find that that locum is a fake doctor. And that's the case in most cases that we find ourselves in. So it wouldn't be easy for law enforcement agencies to really see unless they themselves have been engaged by the HPCSA to be on a lookout. Like I said initially, that you do need a multi-stakeholder approach, where you will, engage even the law enforcement agencies, educate them on how actually to identify fake doctors. But without that information, police wouldn't know what to do, when they pass by a practice that seems to be well established and that seems to be run by a registered doctor.
There might be degrees of deception, if there is such a thing. I'm wondering if some of these people actually do have medical knowledge, perhaps have studied to a certain level, and that's why they are partly convincing. Or are you finding that these people have never studied and they're just taking a chance?
Well, there are varying degrees of, of the knowledge of these fake doctors. Some of them have been to medical school, they never qualified fully or completed the degree, or else they qualified, they tried studying in a foreign country, and even there they never finished the course, they are not registered. Or, there are so many of these variations that you see. But ultimately, they find their way into the system, whether they are, through the state or else in the private sector. Then they start treating patients, and they get paid, because they are employed. But in the meantime, that poses a huge risk to communities, because, you'll understand that this person cannot diagnose and this person cannot treat, or else they are just told that if you are dealing with flu, this is what you need to give. If you are dealing with diarrhea, this is what you need to give. That's the challenge that we're facing at the moment.
All right. Dr. Mzukwa, we're going to have to leave it there. Thank you so much indeed for joining us. Always good to talk to you. Thanks for your time.
Thank you so much for that.